Welcome to The Week in Diabetes and Endocrinology from Hormone Insight. A short edition this week, 3 stories, 5 minutes. This podcast is intended for healthcare professionals. For the week ending May 8th, 2026, the US nationwide launch of Oral Ozempic, a major Lancet trial of semaglutide in alcohol use disorder, and the arrival of generic semaglutide in Canada. Let's get into it. First story. On May 4th, Oral Ozempic, semaglutide tablets at 1.54 and 9 milligrams became available across more than 70,000 US pharmacies. Let's be clear about what this is. Oral semaglutide is not new pharmacology. We've had Rybelsus since 2019 and Wegovy oral since the start of this year. What launched this week is rebranded and reformulated oral semaglutide in 3 new dose strengths with a smaller pill size and the same efficacy and safety profile. What's different is the labeling. Oral Ozempic carries cardiovascular risk reduction labeling for adults with type 2 diabetes and established cardiovascular disease. Pricing $25 per 3-month prescription with insurance, or $149 to $299 per month for self-pay versus $900 to $1,000 for injectable Ozempic without insurance. A higher 25 mg dose has an FDA decision expected by year-end. For your needle-averse type 2 diabetic with established cardiovascular disease, this is a real option. But remember, the fasting administration requirement has not gone away. Patients who can't comply are still better candidates for tirzepatide or non-peptide oral GLP-1s like orforglipron. Story 2. This one matters. Published in The Lancet, a 26-week randomized controlled trial of once-weekly semaglutide 2.4 milligrams in 108 adults with moderate to severe alcohol use disorder and obesity. All participants received cognitive behavioral therapy. The trial added semaglutide or placebo on top. The result: semaglutide reduced heavy drinking days by 41.1 percentage points compared to 26.4 percentage points in the placebo plus CBT arm. Total alcohol consumption fell more. Weight loss was substantial, minus 11 kilograms versus minus 2. The safety profile was the expected GLP-1 footprint. What it means: semaglutide added to CBT meaningfully reduced heavy drinking in a population with both obesity and alcohol use disorder. Our existing AUD pharmacotherapy, naltrexone, acamprosate, disulfiram, is limited and underused, so a randomized signal here is clinically important. The GLP-1 pathway in mesolimbic reward circuits has been a leading addiction hypothesis for years. This is the first prospective randomized human evidence of meaningful effect on hard drinking outcomes. What it doesn't mean: semaglutide is not approved for AUD. Don't position it as monotherapy. The trial enrolled obese patients only. Whether the effect extends to non-obese AUD patients is unanswered. But if your patient with obesity also has moderate to severe AUD and you're considering semaglutide for the obesity indication, the data now support a reasonable expectation of additional benefit on drinking when paired with formal addiction care. Watch this space. Trials in stimulant use, opioid use, and gambling disorder are following. Last story. On May 1st, Health Canada approved Apotex's generic semaglutide injection, Apo-Semaglutide, as the first Canadian-made generic equivalent of Ozempic. Available in 0.25, 0.5, and 1 milligram pre-filled pens for type 2 diabetes. This matters globally. Brand Ozempic in Canada has run $220 to $270 Canadian dollars per pen. Generic competition typically drops pricing by 20 to 40% at launch and continues to fall. For Canadian patients with copay exposure, that's real relief. The broader story: generic GLP-1s in regulated markets like Canada are a precursor to US patent expiration in 2028. The global GLP-1 price landscape is shifting. For colleagues in the Gulf, Asia, Latin America, watch your regulatory authorities for follow-on generic approvals over the next 12 to 18 months. The access conversation is changing. That's your Week in Diabetes and Endocrinology from Hormone Insight. 3 stories this week. Oral Ozempic available nationwide, a Lancet RCT extending semaglutide into alcohol use disorder, and Canada leading the global generic GLP-1 transition. If you found this useful, share it with a colleague. Show notes at hormoneinsight.com. Until next Thursday, keep questioning the evidence, keep learning, and keep putting your patients first. Thank you for listening.